Flexibility of root canal instruments. As a dentist, when we do root canal treatment, are you really thinking about the flexibility of root canal instruments? Are you really concerned about how much flexibility your instrument is giving you? And these are my clinical cases. I've always been worried about these curvatures in the canals. Single curvatures, double curvatures, multiple curvatures. I used to think, are my instruments staying within this curvature, cleaning the canal walls from around and enlarging it to the correct size for cleaning and disinfecting the canals before going for obturation. And Professor Dr. Marco Versiani has done the root canal anatomy project, and he has shown us a huge number of cases where it is so clear the canals are always curved and the apical size is not as small as the companies would like us to believe. The apical foramen are larger in sizes than we usually tend to think. So when you want to do the modern root canal treatment, that is using the tapered root canal instruments, the companies show me pictures like this. They are absolutely flexible instruments and they can stay in the canal, stay within the curvature of the canal and enlarge the canals. Okay, 2010, in my presentation, I was trying to convey this fact to my fellow colleagues. And in 2014, you can see I tried to go beyond, tried to make sense into this. If we consider the tip size and the taper of the instrument, these two factors determine how much flexibility we can have in the instrument. So you can see 3504 how much flexibility is giving. Now number 1006, it is tip size is 10, but since the curvature is the taper is more, you can see it is giving less than a 3504. And then when it is 2002 taper, see how it is flexing. As compared to that, the tip size 35, but there is no taper, so it is curving right from the shank of the instrument. It can traverse through our S-shaped canals and severe curvatures. It's possible to instrument those. So the companies were not showing this. Now in 2018, I was so happy to see this, to see that there are conscientious companies too. They are showing the instruments. See, 3001, it's absolutely flexible. The moment O2 taper comes, it is reducing the flexibility, and tip size 3004 taper. So that's how, when you finish even with the 30 tip size, you see how much that instrument can stay in the canal and enlarge the canals. So it's high time that we start thinking in this direction, and I'm happy that a company has come forward to give this information. Otherwise, I used to think I'm the lone fighter for this.